It's getting cold again, Mary.
Oh, you tell me about it. All right, where is everybody? I asked everybody to be on time, and even our speaker is not here, our presenter.
Oh, I thought she would have been. I thought she would have been here.
Sorry?
I said I thought she was here already.
Nope.
Oh.
Do we have a long agenda?
Why?
No,
No, no.
because I'm gonna have to rush a little, you know. I can't stay too long. So I have to go out in a little while, but anyway, I have to get dressed. I have to change clothes anyway, so because I know that Mary is like this Simon. They have long agendas.
No. Hi, Shirley.
Now, if the YCO meets every month, because I don't receive notices from them no more.
Really?
Huh?
I'll let Betty know.
Oh.
Yeah. We meet on the fourth Thursday,
Okay.
except for November, it'll be the 18th.
Yeah, that's what I have my council meeting on the 18th.
Oh, that evening, yeah.
Mm-hmm. So let me see. Let me post my.
Good morning, Shirley. Good morning, Alana. Everybody's coming in except the committee. Let me see.
Good morning.
Messages on Q&A. Let me see what they're saying.
Good morning, everyone. Hi.
Oh,
Just
Ebenezer, for some reason, my presenter is saying that the passcode is not working for her.
Okay, let's do another way.
Hello?
Let's.
Hi.
Do you have her email handy? I can send her the other link and then promote her.
Okay. We haven't started yet, so yeah. Uh-huh. Oh, okay. Right, but Maria Luna says she's not getting the invites for some reason. Okay. Okay.
Ask her to look in the spam. On the spam box. Maybe she should have it there.
Okay. Is that for me or for someone else, Vanessa?
Bianna said that she is here on, wait. Bianna said that she is here on Zoom but cannot be heard.
Who is that?
Bianna, the presenter.
Oh,
Bianna
okay.
Roy.
Let's promote her. Let's promote her.
Yes. Actually, everybody should be promoted, Ebenezer, because I don't have that many guests, you know.
Okay, very good.
Promote
so
everybody. That would be great.
She should be with us now.
Yes. Bianna?
Yes.
Hi. How are you? Okay.
Good. I could hear everything you were saying, and I was like a fish in a bowl.
Gotcha. Okay.
Good morning, everybody.
Good morning.
Good morning, Dee. Good morning, Betty. So
I
Maria
have a
already,
few, I
Maria
have a few
already
slides to share.
your concern.
All right.
Okay, you got everybody that was in the participant is now promoted.
Okay,
Okay,
but where's my,
want to
where are
be
my,
vigilant
where
in
are my
case somebody
committee
come that
members?
way.
The only one I heard from was Yosef, who cannot be here till about 11. He has a work meeting. I was
Good
hoping
morning,
that,
everyone.
Oh, good
Hi,
morning.
Marie.
good morning. I was hoping that Richard would be coming on to take minutes for me. I cannot.
I'm not volunteer for that one though.
I hear you.
No, I can't write to, I promote my arthritis and my writing a lot.
I got you. And I can't write because my hand is in a partial cast. I had the surgery on Monday, so.
Okay.
Morning, Dee. Nice to have you. Don't see Fern. I don't know if something's going on up the, let me double check the Q&A again. No. Let's see. Well, anyway, we're gonna have the information on YouTube, right, Ebenezer?
Second, sorry.
We'll have we'll have all of the meeting minutes on YouTube or whatever, so that somebody can get see the minutes from that.
Yes, the meeting is being recorded.
Right.
Is also being transmitted in YouTube as well.
Richard, hello, Richard. Let me just wait until he's. Richard, are you able to unmute yourself? Ask. Hi, Richard.
Hello.
I have a favor to ask you.
Uh-oh.
Can you? You see, my assistant is not able to join us until about 11, so if you could take minutes until he joins us, that would be great.
I will do my best. I'm likely to be in and out of things a little bit, but I'll
Okay.
try.
Well, anyway, he'll be able to get them, get the.
Wait, would you like me to take minutes?
I hate to ask you to do that, Betty. I think it's easier from the, recording of the meeting,
Don't mind.
I would think. But anyway, if you want to, jot something down until he gets on, that would be helpful probably, and then you can just send it to what you have, okay?
I mean, I'm glad to do it. I just may not be quite as solid as someone else.
Well, go ahead, Richard, since you're part of the committee, go ahead, okay? This poor Betty's doing minutes, we're bored now. All right, let us call this meeting to order. 10:40 a.m.
I'm glad to do it.
And a quick introduction of everyone that's on board so that we remember who everybody is. I'm Mary Anderson. I'm the chair of this committee. Maria? Introduce yourself, please.
Oh, I'm Maria Luna, member of this committee also.
Okay. Deanna?
Alana, Riverstone Senior Life Services.
Okay, Alana, hold on till I call upon people, okay?
Oh.
Deanna?
Good morning, Deanna Roy. I'm a guest. I am a Senior Associate Dean for Clinical Affairs at Columbia College of Dental Medicine.
Dee? Dee, can you unmute yourself and introduce yourself? You need to unmute. Dee?
Oh, sorry, I didn't know.
That's okay, just introduce yourself.
Hi, everybody. Dee Hernandez, Director of Center for Adults Living Well at Kauai.
Okay. Julie?
Good morning, Shuli Gottman, Director of Mariah Senior Center.
Thank you, Richard.
Richard Allman, Community Board 12 member and a site manager for Arc Fort, Washington, working at the A. Philip Randolph Senior Center.
As well as a member of this committee.
Yeah.
Marie?
Absolutely.
Marie?
Pamela Garson, nurse practitioner from Columbia Doctors. I do house call for the Washington Height and Inwood population.
Okay, Liliet?
Oh,
Liliet Lopez, Outreach Specialist, Night Connect, Center Independence for the Disabled of New York.
Ilana?
Alana Dunner, Riverstone Senior Life Services.
And Betty?
Betty Laban, Isabella Geriatric Center.
Lady?
Hi, Lady from Star Senior Center.
Thank you all for being here. So Brianna Royce was here back in July, made a presentation at our committee about a pilot project they had at the Columbia University College of Dental Medicine. And she's here to give us an update on what's going on with that pilot project. So take it away, Brianna.
Thank you. Thank you so much. I'd like to share just a few slides just as we walk through the presentation. Can I have permission to share?
Yes.
It says it's currently disabled from sharing.
Ebenezer?
Yes, I'm gonna allow you now.
Thank you.
You got it now.
Thank you so much. Great. Well, it's wonderful to be with you back again. Thank you so much, Mary, for the invitation to return and provide a little bit of updates. Last time when we were together, we spoke largely about the telehealth pilot that the College of Dental Medicine was doing with the School of Nursing at Columbia around specifically patients who are homebound. Today, I would like to provide for you some updates about this pilot, but also share with you a little bit about the university's efforts to restart our commitments in the community through our very long-standing dent care program. The program is under new leadership and is going through a set of reimagination and innovation. And I'm excited to share with you just a little bit about the work that we've been doing over the last few months. So first, I want to highlight that as part of the university's commitment, what we call the empowerment zone are these specific area codes, zip codes that Columbia University focuses its efforts on when we talk about community engagement and community outreach. So a lot of our activities, whether it be with Elder Smile, with community partners, with the homebound elderly, with Head Starts as well, is focused around these specific communities in these 17 zip codes, 13 in the Upper Manhattan area, and 4 in the South Bronx. One exciting partnership that has emerged over the last few months is a partnership with an organization called Arch Care. With this partnership, we are focusing on community-based outreach for oral health screenings. So we're working with church leaders and parishes and with Arch Care itself and their partners to have dental screenings at least once every week available around the communities where they make impact. We are also providing care at their program for all-inclusive care for the elderly. They administer 4 sites. And we are beginning, actually today is the day when the teams are on site starting to provide screenings and services. We are in the final stages of Department of Health approval of our new mobile dental unit. You can see a picture of it here at the bottom. This is a very proud collaboration with support from the Delta Dental organization. The $500,000 grant was given to Columbia about 2 years ago to conceptualize this new mobile medical unit. This unit goes to replace the old van that Columbia has had in operation for nearly 2 decades. This is a state-of-the-art mobile medical unit. It has beautiful 2 new dental chairs and is equipped to provide preventive services and early intervention services to elderly and also children. So we're excited that through the Arch Care partnership, we are both doing community screenings on site where we meet people. And then after we screen patients, we're also able to provide appropriate referral both to the van and also to other clinics, depending on the complexity that the patient presents with. So this is part of this collaboration with Arch Care, and the community screenings and the care that we'll be delivering is partially in collaboration with the Mother Cabrini Foundation. It's a 14-month pilot to develop this pipeline for care for seniors in this community. We're also delighted to share that we have restarted our commitments with the traditional Elder Smile program. Columbia has had engagements with the Grant House and the Jackie Robinson Senior Center, and we have held now 2 events in the fall, one in September and one in October, whereby we're engaging seniors in screenings, oral health screenings, blood pressure screenings, and diabetic screenings, and focusing on conversations of prevention and screening for urgent needs and referrals. This is not a site where we're doing, at this point in time, hands-on interventional care, but we are identifying seniors who need assistance with getting to care. We have patients who have mobility issues. We have patients who have hearing and vision issues and need additional support to help them get connected to a healthcare provider. And I'll speak with you a little bit in a little bit about a unique position that we've created to help seniors with such challenges to be connected to these services. We have also restarted our collaboration with the St. Mary's Church. And this is a student-supported free dental screening event that happens every other Tuesday at the St. Mary's Church on 125th Street. The screenings are in the evenings. They are provided by dental students with supervision by licensed and faculty credentialed dental faculty. This is a collaboration. There are medical students with medical doctors providing health screenings, and side by side, there are dental students with dental faculty providing oral health screenings for patients. So we've been at it since September. It's going really well. There's high demand, as you can imagine, because these services have been interrupted for about 18 months. And at this point in time, we are working with the church leadership and the police precinct that is right nearby in the area to help identify parking space And as our new van becomes fully credentialed by the Department of Health, we hope to be able to actually bring the van on these Tuesday evenings so that once the patients have their screening at the church, we can actually move them onto the van to provide some interventional services such as, limited x-rays, limited cleanings, putting a temporary filling or addressing something that maybe is urgent and causing a person discomfort. So we're very proud of this, operation, and there's a lot of enthusiasm. This is part of our service learning commitment, and it imprints on the students certainly what it means to be a healthcare professional and this lifetime of service. We are very proud of the homebound elderly telehealth pilot. Last time when we spoke, we identified a lot of barriers to telehealth and how difficult, it has been for the community to lean into this technology. However, in this pilot, if you remember, we are leveraging the expertise of a nurse practitioner who is bringing her own technology to the patient's home and is therefore moderating that connection between the dental provider and the patient who's bedbound. So we're not dependent on the patient having internet or the patient having access to Zoom or knowing how to use the technology. And this is one of the steps that's helpful to overcome this digital divide. At this point in time, the home care visits that are done by Marie Garçon are continuing. We are continuing to screen patients on telehealth. Dr. Kresh is our lead faculty, and he's on a couple of times a week with dental students, providing that connection. During those conversations, we meet with the patient. We can have family members participate, home health aides participate. Whoever is engaged in the care of the patient can participate to understand a little bit closer the patient's oral health issues. Marie is using an intraoral camera, so we're able to provide really much more enhanced kind of assessment of what's going on with the patient through the use of this unique technology of using the intraoral camera. At this point in time, we have developed a small waiting list of patients who are ready to be seen on the van. Again, this is another operation that will transition to the van once the van is finally accredited by the Department of Health. We are expecting that we already had the site visit on the van, and the Department of Health is expected to issue their approval sometime this week or next week. So the idea here is that we will now build on the collaboration with the physical therapy students and faculty to discuss, unique needs for transporting these patients from their home environment onto the mobile van. Again, these are not bedbound patients, these are homebound patients. So we are targeting patients that could still be, transported and moved. And the idea is that if we can bring the van close to them, we don't have to spend a lot of time trying to find a setting that's far away and then managing and coordinating in that setting. We can bring the setting close to the patient's home. So we're very much excited about that. We are also working on expanding that pilot to allow Marie to become a credentialed faculty member at the College of Dental Medicine. This will permit for her to take one dental student along with her to the patient's home. And with the dental student on site, we're able to now provide even more care bedside with the patient, including things like fluoride varnish application, oral hygiene discussions, and even the use of more or less newly used silver diamond fluoride. This is a special medicine that we can put on a tooth to help to stop or arrest the cavity from progressing further. It's a very, very powerful tool in the community setting. It's used in a lot of rural settings in the United States. And it really helps to buy some time to stabilize the patient until we're able to get them to a more permanent point of care. Additionally, we are working with social work to understand the regulations around home health aides and their ability to provide oral health care and daily, support patients with daily hygiene care. There are some concerns that home health aides have been instructed to not provide that care for the elderly because of concerns of elderly abuse or worries about the aide potentially breaking the denture or the appliance that the patient is wearing. It seems to me that we're trying to understand a little bit more about where those policies are stemming from. This is an absolutely critical point of support for these patients. Some of them may not have full use of their extremities, and not having an aide provide support, having them provide support for all activities of daily living and not this one seems to be like we're creating a big gap here. So we are working on some advocacy and understanding about that. The College of Dental Medicine has also begun conversations with an American Dental Association run program called Vet Smile. This is an organization that's doing advocacy on behalf of the veteran hospitals to bring a network of providers that expand on the activities at the VA. The VAs are not able to provide services, oral health services to all of the members that they need to reach. And there are long waiting lists. And so this is a national program to try to lean in on dental schools across the country to build out these networks for veterans to seek care. There's no funding support at this time for this program. And so we're just working on providing a capitated number of patients that we can take in every month for whom we can begin to offer services. Columbia College of Dental Medicine is focusing on specifically Washington Heights and South Bronx areas for this initiative. I'm also excited to share that in addition to the new Delta Dental van, the one that I just showed, that was a $500,000 partnership with Delta Dental Association, we are now also in receipt of another $500,000 from the Mother Cabrini Foundation to build a second mobile medical unit. And this new concept, and you can see the little bit of a fuzzy picture, does work off of an integrated model whereby we plan to provide services that are integrated with nursing and medicine. And you can see that the one wing of the van on the very back has a traditional dental setup. It also has a wheelchair lift and a wheelchair tilt so that we can accommodate patients who are wheelchair bound and do not have to transport them to a dental chair. In the middle of the van is an area for sterilization of all of our instruments. And in the very front of the van is a traditional primary care setup with ability to provide services around women's health, screenings, diabetic care, vision care, vaccination endeavors, and various others collaborations that we plan to have with our medical colleagues. So this will be an integrated concept, and the target completion for this van is the fall of 2022. I'm also excited to share with you that these initiatives would not be possible without leadership. And I'm very proud of the new team that we have assembled here at the College of Dental Medicine that is going to help to lead the Dent Care program into the future. We have just onboarded last month Dr. Amy Herbert, who is an assistant professor at the College of Dental Medicine in the Division of Pediatric Dentistry. She is a board certified pediatric dentist, but has intense commitments to public health. She's currently pursuing her master's in public health at the Mailman School of Public Health at Columbia. She is going to direct the program and be responsible for both the elderly care and the pediatric arms of the program. We also onboarded Dr. Julia Tepper, who is one of our recent graduates from the College of Dental Medicine. who is our lead faculty in the dent care program and, uniquely focused on the activities of Elder Smile and Arch Care Partnership and commitments for elderly adults and care for elderly adults. She has been with us since August, and we're happy to have her leadership as well. As you might know, nationally, there is a huge shortage of drivers who can drive large vehicles. There's a shortage of school bus drivers and truck drivers. These are people who have a Class B CDL license. We were very fortunate to find Ms. Colette Lennon, who joined us just a few days ago, as she's going to be a key team member for us to be able to take the van on the road and bring the mobile medical unit to the community. So she joined us and she's with us now, and we're ready to start those operations shortly. And I'm very, very excited to share with you a new role that we created at the College of Dental Medicine that is an American Dental Association role called Community Dental Healthcare Coordinator. And Mr. Daniel Lopez, who has been serving in the community, largely working with HIV patients over the last decade. He's a registered dental hygienist as well, and he is going to be our Community Dental Healthcare Coordinator. Daniel is the first CDHC in New York City, and his onboarding and getting this position launched has been a wonderful thing, and we're able to do it with collaboration with Delta Dental and the grant that we received from Delta Dental to create and onboard this position. This position is critical in helping patients to connect to the correct points of care and to coordinate services for them. You will see here that this person promotes health by giving patients education, providing leadership, focusing on prevention services, and to support underserved communities. This role, is typically held by people who are members of the community where they serve and where they trained, and where can they integrate this information about oral health and overall health into the community in their own language, culture, understanding the value system, and therefore reducing many of the barriers to health services that we try to overcome as we build trust with the patients that we serve. This position is focused on addressing some of the underpinnings of what we call social determinants of health. These are areas of economic stability, access to education, access to good quality healthcare, conditions that navigate the neighborhood and our built environments in which we live, and social and community contexts in which our patients operate. So Daniel, is a native of New York. He is bilingual and brings a lot of experience working in the community, and we're so proud of him to have taken on this position. We are also collaborating through another partnership with New York State Dental Association on bringing in another CDHC, Stephanie Allen. She has done a tremendous amount of work with Head Start in the Finger Lakes region, and she's now transitioning part-time to help support us in the community endeavors that we have going on in dent care that I shared with you today. Some next steps for the College of Dental Medicine and our community programming is thinking about how to improve engagement with members in the community as we resume and rebuild these partnerships, and to think about advocacy and sustainability efforts as we think about services, we do around services. We're going to be mobilizing a second van next year. How do we sustain, maintain that so that we can continue to be there for the community in the ways that we have been and better? And another focus on community-based participation in all that we do, including any kind of research or innovation that we try to do in our new systems thinking and how we provide services. We'd like to be able to build on that with our community partners so that we understand and capture those voices. So I just want to stop here and thank you for your time. This is just a slide about all of the collaborations and organizations that are involved and are part of our rebuild of the dent care program with new leadership and since the post-pandemic restart. Thank you for your attention.
Thank you very much, Bianna. If you could now unshare your screen so I can see everybody. Thank you. Any questions from committee members first? Seeing none. Hi, Fern.
Hi. I know I came in a little late. Can you give me the address of St. Mary's Church?
Yes, it's 125th Street, and I can tell you right now. I'll put it in the chat, okay, Fern?
Yeah, that'd be fine because I believe we have some members in our 2 Central Harlem locations that would be quite interested in knowing more about that program.
Absolutely.
That's probably around there is a little street called Old Broadway there. And it's just hidden, you know, the subway, the #1 train goes.
Yeah, all the way on the west, right, Maria?
Like 1 block away from, maybe a block away, because those big projects that are going, you know, Amsterdam Avenue, but between Amsterdam, Old Broadway, and the new Broadway, and 125th.
It's 521 West 126th Street. 521 West 126th Street, St. Mary's Episcopal Church.
Thank you.
Thank you. Anyone else on the call have questions for Bianna?
Mary?
Yes.
Just wanted to make a comment for Dr. Roy. If you need advocacy regarding home attendance, you can always feel free to contact me and I can put you in contact with our NICONEX director regarding the home care.
Thank you so much for that. We will do that.
Okay.
I appreciate it. I will connect Stacy Whalen, who is our social work director here at the College of Dental Medicine, and she and Maria have been, you know, at it for a little while, so we'll connect them with you to follow up.
Perfect, because besides our director, we do have someone in charge of policy.
Yes, we have to overcome this. I don't know where it stemmed from. You know, probably one complaint can sometimes take us into a completely wrong direction. And this, in my opinion, is a very wrong direction. We need to
I'm a little surprised, you know, I don't have the answer for you, so I can connect you to the right people, because when they do the home care evaluation, they do ask if you need assistance with showering, brushing your teeth, because I myself have CDPAP. So when I did my evaluation, they asked me all those questions, but I'll be happy to connect you with someone that knows more.
Fantastic. Thank you so much.
Hi, morning. So just had a quick, I don't know if you, so we've had some members that have made reference to needing to get like dental implants and things like that, but their insurance not covering completely and the co-payments are like astronomical. Are those type of services something that would be offered on the dental van or like through the clinics?
Those are considered sort of advanced surgical procedures, and that's not something that the van is, you know, properly equipped to do. These should really be referrals to the College of Dental Medicine. You know, we do offer, while it's not free care, it is significantly reduced care, especially when the care is provided by our residents with faculty attendings standing by. So we can certainly, you know, triage the patients, understand the complexity of their unique needs, and then assign them to correct level provider. The mobile van, the scope of those activities is going to be largely what we call disease management. Phase 1 disease management. It's focused on prevention, diagnostics. We'll be able to take, you know, films, x-rays. We'll be able to do a complete exam, and we'll be able to provide dental cleanings, deep cleanings when we need to. We'll be able to provide simple restorative, you know, fillings to get rid of cavities for patients. And that's really the extent to which we can provide services in a setting like that. For children, we focus on sealants and prevention, fluoride, varnish, and sort of that kind of focus.
Thank you.
For the elderly, the other thing that we may be able to do on the van is adjustment of dentures. Sometimes things settle over time and people get sore spots. And so we'll be able to do a little bit of adjustment and kind of bring about comfort. At some point, maybe next year, as our programs expand and we get a second van and we're able to provide a broader reach, we might design a community program around fabrication of complete dentures. There's a program called, not to bore you, but it's called Laurel Denture. It's a denture that could be made in one day. It's often done in community events such as, ADA cares or, local kind of events that happen annually in different states. And so for us, it would be a curricular change. We would have to make sure that we can adopt it in our educational programming so we can train the students and then make sure that the faculty are all, aligned to it. And then that's something that we might be able to offer in the community. But I don't envision that for this year. It's probably something we can think about for next year.
Okay, anyone else? Betty?
Oh, no. I was just gonna say.
Oh, I'm sorry, I had one more question.
Okay.
This was a very powerful presentation, and I know
Yes.
you want to get it out to the community. So I know Fern's on the, Mary and Fern are both with me on WICOA, Washington Heights Inwood Council on Aging. And I would think it would be wonderful if we could schedule you to make a presentation to all of the community groups that participate in that organization. So I just want to put that out there. Fern, it's up to you to figure, assess whether or not what the schedule would be and so forth.
So I believe we're pretty tight through December, but I think that for early 2022 presentation, especially thinking about how things might roll out in 2022, I think that's really important. Bianna and I have mentioned previously to one another that my interest is in broadening the reach to the community at large, not just to our homebound clients, but to the broader base of clients who do not really have dental coverage, do not really have the money to pay for dental care, and who may or may not be willing to go to the clinic, but might be more willing to see a dentist or dental student on a van. So I think that with that filter in mind, Bianna, we'd love to have you in the late winter or early spring.
Yeah, absolutely. And Fern, I'm not sure when you joined, but the focus of today's presentation was just to highlight some of our efforts that we have going on. That is the homebound project being just one of the various efforts that we're now restarting.
I really appreciated you putting it in context because I know last time I gave you a hard time. Both about the van, and about the focus. So I really appreciated your change of context. Yes.
Yes, I'm happy to give a wider lens. Absolutely.
I was just
Maria Luna.
Yeah, thank you. Just a comment because I for the last few years, every time you go to the dentist, the fee, the rates are getting higher. This type of service is extremely important. As he says to me, if you don't take care of your your teeth, you're going to be you have problem with nutrition because people, especially the elderly people who don't have good teeth, suffer from they cannot eat proper things and things like that. So it's extremely important that we get as much services for dental services free as is possible. Also, one of the downside of being elderly, about someone mentioned the implant, most dentists do not like to have, I recommend implant for elderly people because it takes a long time to do expensive, extremely, no one covers that. And if you're going to have spend $6,000 or $7,000 for one tooth, and you are 85 years old, you think about it. So they don't recommend that for elderly people. for the younger people, they do, but I think that if the students do a fantastic, work, so why not take advantage of them?
Thank you so much, Maria. You should know that I'm in close discussion with Dr. Griggs, who is the director for the Department of Health, and also with the medical directors across different managed care organizations, HealthPlex, DentaQuest, that are administering Medicaid services in the state of New York. And one of the conversations that we're having is around lower dentures, which traditionally are very difficult for elderly patients to get used to, just by the design, the anatomical design of how those dentures sit. And we're working towards a system whereby lower implants, 2 to 4, that we know can significantly improve the quality of life and the quality of function with an appliance like that, could become a benefit under the Medicaid program. Right now, the state is playing games. They want medical necessity explanations. They want letters from MDs, and there's no clarity exactly what is the medical necessity. There's not a list of conditions. So they're just sort of dancing around the issue. But I think it's been brought to the table. It's under discussion. And so it's my hope that, while we certainly are not asking for, a mouthful of implants, something that can significantly improve somebody's nutrition and ability to enjoy and have a respectable quality of life that the state could potentially cover. And so to be continued on that.
Thank you so much, Bianna, for this really awesome presentation and updated information, which, gives us some hope for the future of helping our elderly and the community. Thank you very, very much.
It's my pleasure. Thank you.
Can I just add one more thing, Bianna?
Yes.
I love your enthusiasm. And this and WICOA are 2 really good groups for advocacy. So you should really think about us in that context as well, that when you want to advocate with the Department of Health or any other program, that we're a really good resource.
Okay, I love that. I'll take you up on that offer, because we go into those conversations and it's nice to have, community leaders that could really speak to it in their own voice. It's not just, administration of Columbia harping on them, but it's actually coming from the voice of the community. So I think I'll take you up on that. I appreciate that.
Richard, did I see your hand up? Yes.
It's for 2 things. First, Bianna, I have a little bit of a life outside Washington Heights and Inwood. And if you're looking perhaps to connect with other community boards, aging committees in Upper Manhattan, I'd be glad to be helpful on that.
Okay, thank you so much. I'll follow up, and I think, Mary, maybe you could just connect me with just email contacts, and then I'll set up some time for us to just individually have discussions after this.
Okay. And the other thing was a question to Mary. Are we set on notes at this point? Note taking at this point?
I believe, Joseph, can you take over the minutes from here on? Okay.
Okay.
And
I'll
then
produce
Richard, you can send whatever you have to Joseph.
Mary, I've been taking notes for the meeting. For this meeting, I've been taking notes.
I'm
Did you
sorry?
want me to? I took notes for this meeting. Did you want me to?
Oh, okay. All right.
So
whatever
can
have.
you share them with Richard afterwards?
Yeah, I'll send them to you, Joseph. Or
Richard, I think, has been helping out for this one. I had to come on late.
I think the way it happened, I think Betty and I both volunteered. I think it's probably best if we both get what we have to you, Joseph.
okay.
Right. Perfect. Thank you all so much for helping out with that. Since I'll show you all my hand, the ones that came on late, I can't write. So, all right.
I'm going to jump off now just because I have to run, but it's good to see you all this morning, and thank you again.
Okay. So keep us further updated if there are, further advancements in this pilot. Do, let me know, and we can always have you come back again. Okay.
Thank you so much. Have a good
All right.
morning. Bye-bye.
You too. All right, as far as the agenda goes, I have update on senior centers. Unless there's anything really drastic going on, I have something that will come under new business as far as the senior centers go. We'll get to that. Fern and I discussed that at the Waikoa meeting, actually. So we'll bring that in under new business. Again, looking for ideas for future presentations. I have the possibility of somebody that wants to present to our committee, but I'm not sure if it's appropriate for our committee or for possibly the Health and Environment Committee. I have to call this person. They're wanting to set up a new corporation called Wellness in Inwood, intended to provide counseling services to those currently using alcohol and other drugs. It's not clear to me from this email whether they are planning to target the elderly population or not. Although Eleazar, the chair of the board, mentioned that they said that, but I want to get, call her and have a discussion about that first, because if it's not going to target the elderly, then I don't think it's appropriate for our committee. So, to
Mary,
be
can I
determined.
just ask you about that organization? Is that a not for profit? Is that for profit? Is that, what is it that they're going to, what are they offering? What are they proposing?
I don't know all those, like I said, it's not clear to me exactly what this program is all about. So I have to get more information. I can, if anybody wants to see this, this letter, this request for presentation, I can send it to you. And you can give me your opinion about it.
They can present if they have, I think we have to give people opportunity to give us, information on what they are planning to do in our community. We don't have to commit to anything.
Well, we can do it under those auspices, but like I said, I wonder if it might be better under the Health and Environment Committee. If it's not going to gear towards the elderly.
Yeah, but they know clear. We know clear what they do, so it doesn't. I mean, if we don't want to hear from them, that's fine.
Or the other thing we could do is have them do a presentation, and then we can, since this is something, it's a new proposal that they want to begin. Maybe we can convince them to have something specifically for the senior population.
Right.
We could go that route.
We can always refer them to the proper committee if it seems really important. I mean, we can. I don't know.
I mean, it may be appropriate for both committees. Who knows? All right. So, after I speak with them, I'll try and figure that out. If anybody has any other ideas for future presentations.
I agree with Maria. Let them show their present whatever they have, and then we can either support it or say yay or nay about it, and present it to our core meeting or the community.
Gotcha.
I have another thing, if you don't mind. I said I was going to leave earlier, but Mary, is it possible we can get in touch with the Fort Washington shelter, the 168th Street, to see how many, if they have an idea, how many senior people do they service there? I mean, how many is that the population? I see a lot of elderly people there, and things like that. Maybe we have an idea what to, how to help them and how to, control some of the situations that we have around our community, people wandering around. I don't know, it's just, maybe they can give us numbers.
I'm sorry, I didn't hear the first part. I had to turn up the
The
volume.
shelter, the Fort Washington shelter, 168th Street. We see a lot of people, you know, there's a problem around our community, of course, with homeless, but around there is a people who looks like, you know, elderly seniors that are not too young. And I wonder if they have any idea how to help and look for help for those people. And maybe we should have a also an idea of what is happening, you know, with the elderly that goes there.
Okay.
Because I think we have someone new at the, you know, the shelter, right? For the last few months, a new director. The
I hadn't heard that. I don't know.
It's Project Renewal, right?
out.
That it runs the shelter.
I don't know. Ebenezer, do you know anything about that?
Project Renewal is the managing agency, and I know the woman that was in charge of that particular program did retire or leave.
Right.
I don't know who the new person is.
Yes, Project Renewal. Yeah, you're right. The director retired a few early this year. She
Got it.
introduced the new person. She brought it to the district service cabinet meeting several times, but she hasn't participated. We sent the invitation, but I haven't seen her in the meetings.
If you could send me her contact information, I'd
Sure.
appreciate that, because maybe, you know, I can speak with her and see what we can do.
Sure.
Okay, thank you. Thank you, Maria, for bringing that up. All right, now under new business, I just wanted to briefly, because not everyone got the, you know, committee members get the results of the budget requests and the, you know, how the full board rated the different items for the capital expense budget. So I wanted to just review that quickly because the items having to do with connectivity and Wi-Fi and that got rated pretty well. System-wide upgrade of CB12M area to improve access to connectivity and Wi-Fi ranked a 5 in the whole board ratings. And the third item under the capital is that was actually under the housing committee as well. So it got ranked actually number 8, provide funding for construction of affordable accessible housing for seniors. It got ranked number 8 by the whole board, but under the housing committee. And, you know, that's fine, you know, because there are items that cross over into other committees. Funding for free Wi-Fi access for seniors in CB12 rated at number 7 from the whole board. So I think that, you know, is great also. Other items didn't rank as high. The one other thing was the mental health services, which has been under the Health and Environment Committee. Hold on a second. Under the expense budget, expand mental health services in the community, because we decided to let the Health and Environment Committee hang on to that since it also falls under, you know, their area. Ranked number 1 as it did last year from the whole board. So, you know, the importance of mental health services for the seniors is, you know, is high on everybody's mind up there, number 1. So that's that issue. And the next item under new business is a request that came out of our Waikoa executive committee meeting. whenever that was. I can't remember now at this point. But Fern, perhaps you could just fill us in on that.
What were you
item.
asking?
The award to all senior centers, but not receiving enough money, not getting
Right,
what was
well,
asked for. And also wanting to perhaps, have a letter of support. So just, a little background on that one.
I'm sorry, Fern, just before you start, I need to jump off. I have another meeting.
Yes.
So I'll watch the recording later. Thank you, guys.
So
All right, thanks, Dee.
Dee, don't go anywhere.
Yep.
Go to Marty, yell at him, tell him he promised me an email
Okay.
with his comments on the draft letter that I wrote.
Okay.
And if you don't have my email address, do you want me to throw it
I
into
have
the chat?
I have it.
So make him send it today.
Okay. All right. Thanks.
Thank
Bye.
you. Okay. So I already wrote a draft email for Waikoa. A lot of people weighed in. The Norks actually asked me to take them out. They are not negotiating budgets yet, they said, according to Carol Ban. We do know that all 9 of our senior centers in Washington Heights and Inwood did get recontracted. We do not know budgets, any of us. We were given a number. Usually the number is almost exactly identical to what our budget was prior to this process. And for most of us, that's just insufficient. DFTA has said that they will negotiate with us, but no negotiations are happening yet. They want us to take our budget and make an argument for it, which of course is what we did in the response for proposals in terms of a budget justification. Now they want, I think, to write it into narrative form. It's basically, okay, I can say it in narrative form instead of in a budget justification form. But the information is the same, which is they want to give us the same money, which means no salary increases, no rent increases, no cost of living increases, and food has gone up outrageously, as have utilities and delivery services. And that's not to mention that they wanted us to expand what we offer in the senior centers, which there is no money for that either. So that's where we sit. We've written a pretty strong letter from the Waikoa group and under that umbrella from the Directors Committee on the need for these budgets to be robust. I sent it out to the entire committee and have gotten a lot of feedback, mostly positive with a few small changes, except one bigger one that Marty thought I was a little bit nasty to DFTA and he wanted me to say things nicer. So I said I would, which is why I asked Dee for the wording. But that letter is ready to go and I would love to share that with you, Mary, and for you to be able to adapt it from the Committee on Aging perspective so that we have 2 voices with different interests saying a similar thing, which is older adult population is growing, baby boomers is growing, the need is growing, the budget has to grow comparably with that.
Ilana.
Yeah, just to chime in on that, just to sort of unload. I mean, it's been a very dispiriting process, regrettably, because originally DFTA had asked us to, they didn't give us an amount that they were going to offer. They said, just put in what you need. So we spent hours, of course, doing that. And then it turned out that that's not really what, they're not, following through with that. Anyway, so we all, submitted revisions and we'll see where it goes, but it's quite disappointing. As we all know, our staff salaries are so embarrassingly, depressed. And so anyway, so we're hoping for the best, hopefully that there is real negotiation rather than just lip service to that. But we'll see. We'll see where it goes.
Okay.
Mary? Mary,
Yes.
just to pick up on what.
Yes, Betty.
Support, can you hear me? I
Yep.
think the support from the board would be great, but it would have to come in the form of a resolution. We can't do a letter of support, we have to do a resolution, which I guess we could compose based on the letter that's already been drafted and maybe get it before the executive committee this month maybe and get it up for review, perhaps for the November meeting. I don't know what the time frame is for the response coming from the centers, you know, but we would have to do a formal resolution if I'm not mistaken.
Okay.
So
If I remember right, previously, Richard, didn't you help draft a reso for us? Richard,
Did you ask that question again?
I said, didn't you previously help this committee draft a resolution?
I was distracted.
Anything.
Yes,
Yes, he did.
So my suggestion would be that I email Mary for distribution, the draft letter that I already have, so that that can be looked at in terms of turning it into a reso. I would certainly support making it a resolution. I think you're right, Betty. I think that's the proper format for Community Board 12. And I think speaking to the rising number of seniors and the increasing needs, especially following the pandemic, would be sort of the whereases.
Would this letter would be sent to DIFTA, is that correct?
Correct.
Yeah, no, if we could do that sooner than later, like right away, because yesterday we were due our revised budgets. And they're probably going to call us in or, you know, talk to us about the budget. So if we know,
I don't think, I'm not saying no, I'm saying I don't think they're working that quickly.
They told me, you know, and things changed January 1st. They're expecting, this one guy said, Jose Mercado said, January 1st, they're anticipating the start of the contracts.
Right, because they want to try to get it done before a change of mayor. But that doesn't mean that their processes are fast enough to actually accomplish that.
But we don't want to go into negotiation, I think, before we get this letter to them.
No, I would agree.
Yeah, yeah. So it'd be good to get it done quickly, that's all.
my suggestion is, Mary, I was just going to say, why don't we, one thing we could do now is a vote on the resolution of the committee.
Yes, yeah.
And then the narrative can come when you and Richard work on that, but then you're in a position to present it to the executive committee coming up this month. And then to the general board at the end of the month.
Yeah, and I like it as a 1-2. I like that we have it coming from community directors and programs and also coming from the community more broadly in the form of CB12.
Yeah.
Exactly. Shirley, did you have something you wanted to say?
I just wanted to say, I'm not sure, Alana, when she was talking about the speed, because the budgets are due. Frankly, to be perfectly honest, there's a problem with the spreadsheet. I don't know if it's just unique to mine or if everyone else has this. There's a calculation error in one of the cells that we cannot change. And it makes it impossible to submit the budget. And we sent a letter to Jose Mercado last week, and we still haven't heard back on what to do about it. It's calculating the fringe instead of for instance, if the fringe is 25%, it's making my total fringe 25 cents instead of whatever it is. And that affects every other tab. And we sent them this information. And when it calculates on page 1, in one place it adds up the total fringe, then it tells you what the percentage is, and whatever your percentage is, that's how many pennies they're putting in for your fringe on the first page on the summary page. It's impossible to calculate your anything once they're doing that. And I've sent him an email twice and have not yet heard back. So they can't rush us to submit something that is incorrect. It just doesn't calculate.
No, certainly. I'm going to have to ask my fiscal manager about that because she didn't mention that to me. So we have to take a look. Thank you, Shuli.
Also, I think that Vika said that they sent her a revised form, so you may want to have Connie call Vika to check if we have a revised form.
She had that same problem?
We had some calculation error that Vika told me about, and they sent her a revised form.
Yeah, and so did we, but I don't know specifically if it's.
But I
what
don't
you
know
were-
if that's what it was.
Yeah.
Okay, so we should have a vote on, for the committee as to, for a, I'm losing my vocabulary words
for
here. I think my
resolution.
hand is killing me, that's why. We need to have a, what am I trying to say?
That you want a motion.
Thank you.
To create a resolution that will reflect the committee's point of view on the need for robust negotiations and enhanced budgets for the senior centers, older adult centers of Community Board 12.
Okay, so members of the committee.
I have a question.
Okay, go ahead.
How should I vote? Because I'm a member of the advisory board for DIFTA. Do I recuse myself or do I vote?
Yes, you should recuse yourself because you're not only on their advisory board, but you're on Alana and my board of directors. So you have to say not voting.
Right,
All right.
due to conflict, right.
Right.
Okay, so Maria will not be voting due to conflict. Are there any objections from the committee members?
Is there a second to my motion?
I'm sorry, second, thank you. Richard, seconds, right? Thank you.
Yeah.
Okay. So are there any objections from the committee members to this motion? Hearing none, it passes the committee. Are there any objections from the rest of the people who are
Wait,
on?
one second. So what's the vote? How many people are voting?
1,
So
2,
it's
3.
me, Maria, Richard, Fern, and Joseph.
But Maria
Right.
can't vote, you just said.
Our Maria can't vote, so it's 1, 2, 3, 4 committee members.
Okay.
I count 5. Wait a minute.
My committee member?
No.
No.
Oh, okay.
So you're right. It's 4 committee members.
4 committee members, 1
Betty,
board
are you
member,
on the
one
committee?
community board
no.
member, Betty.
I'm not on the committee, I'm on the board, but I also am
I mean, yeah,
I'm
board,
on
that's
the
what
board
I'm
of
saying,
the-
the community board.
board of Star Senior Center. So that
Right.
also,
I'm sorry?
Right, but you're not in conflict because of that, because you're not also on DIFTA's board.
that's right.
Right,
So I'm a board member, but not a member of the committee, and I vote
Right.
no.
right.
So you're
Yeah.
you're the only one though that's a board member but not on the committee that's here, right?
Correct. That's right.
Okay.
And then it's Alana, Lady, Shuli, Liliet,
Agree.
and Marie. So you have 5 community members.
You have Liliet?
Liliet, yeah.
Okay.
Liliet, Marie Garcon, Shuli, Alana,
Okay, so
and
there
Lady.
there
Five.
are 10 people in total who voted, and I counted 4 committee, 1 board, and 5 community. Does that make sense?
That's right. That's right. Because you have 1 abstention from the committee.
Yep. Okay, thank you all. So,
Can I just add one more thing on new business?
Yep.
Did you guys, because I know I've been in and out a little bit, did you talk about the tablets?
I talked about the budget results.
Okay, so the senior centers have all been asked to do outreach to community members to distribute tablets.
Okay,
And those tablets include wireless through June of 2022.
okay.
Maciel from the NORC reached out to me saying that she has some members of the NORC who may not have been on those lists. And could she reach out? Could we reach out and see if they can get tablets? I know our numbers were not equal to the number of, our people who accepted them were not equal to the number of people asked. So I think that we might want to ask DIFTA collectively if we can get more tablets for those seniors who are not on those initial lists.
Well,
Makes sense.
Vern, there was a substitute list that we could submit. People who
Right.
are not on that list.
But there are more people now hearing about it. What's happening now is the word is spreading in the community. And now people are coming in and saying, what about me? What about me? What about me?
Okay. I mean, you know, we were allotted 170 odd, but only 40 people that we called actually wanted it.
So that's interesting. We had a list of over 300. We were allotted also about 175. And we're giving out about 133.
Oh, that's great.
So but we should all be in touch with each other, because if they will allow substitutions or additions, then those of us who did not distribute as many as we are may have that leeway.
Okay, good.
So I just wanted to get it into the notes, because we've had such a pointed conversation over the last year about lack of connectivity and tablets and ways that we could start teaching seniors to use virtual programming better. Thank you. Thank you, Mary.
Okay, great. Now, I just want to go back a little bit to the reso as to who's going to help me draft that, because like I said, I can't write and I can't really be typing on the computer. I'm having a lot of, issues around that. Richard, you are volunteering to help me?
I think I volunteered him.
Got it. Okay, let me thumbs up. Bad thumb even.
I'll do that. I wasn't taking notes as we went through that, so someone should just give me some text to start it.
Well, I'll give you the letter, and I think that you'll see that a lot of the text will flow from the letter.
Yeah. Okay, thank you. Any other new business or old business? Actually, that was an old business. Okay, announcements. Anybody have anything? Nope. Our next meeting will be December 2nd at 10:30. And I look forward to seeing everybody then. The weather's getting colder. Stay well. Get your flu shot.
And we are helping people get boosters. So if people need appointments with boosters, send them to the senior centers. We're all assisting clients to get those appointments at the Children's Hospital of Presbyterian.
Okay.
Awesome.
Vern, I have a question for you, having nothing to do with the committee. It's a personal question. So if you can stay, I don't know.
Sure.
Maybe I can just call you, because
call me.
We're going to be cut off. We're going to be cut off in a couple of minutes anyway. So
I think any of the centers are having Thanksgiving dinner, something like that. I received an invitation by a group from Harlem that they are asking for donations for Thanksgiving. So I'm just, I'm not referring for that type of thing, but just having indoor celebration now for Thanksgiving or not.
So we are gathering names. If we get sufficient names, we will be open. If we do not get sufficient names, we will actually send Thanksgiving dinners home. But we do have funding to be open.
Mariah will be open on Thanksgiving. We have a traditional Thanksgiving luncheon and turkey and all the trimmings. Well, not all, some of the trimmings. And we have a concert afterwards.
Oh, nice. No, we're just having our regular catered food. It'll be a little, with turkey and so on, but otherwise, no.
And not on Thanksgiving Day.
Not on Thanksgiving.
Yeah, same here. On Thanksgiving, we plan to be closed. I'm sorry.
Go ahead.
Go ahead, Maria.
No, just finish your statement.
Oh, okay. On Thanksgiving, we're planning to be closed, but on Wednesday, we are planning to have like a special dinner for the senior.
I just wanted to know that some of us knew Sandy Doolittle and Sylvia Doolittle. They used to be members of community board at Yeshiva University, and Sandy passed away a few years ago, about two years ago, and Sylvia just passed away last week. They were very active at the Y. They used to go to the Y, but they were members of the community board. As a matter of fact, Sandy was a chair of the community board many years ago. I just wanted to let some of you know, that knew them, that they both gone. They, they moved to Florida, and unfortunately, they go, they go. So.
Okay, thank you.
Betty, are you going to be in today or tomorrow?
Yes, I'm going to be in tomorrow, actually.
Okay, because I'm still walking around with the Waikoa check.
Oh, perfect. Good.
Okay, I'll see you tomorrow.
Okay.
All right, so let us adjourn this meeting
Okay.
at 11:55 a.m. Thank you all, and Fern, I'll call you right back.
Okay, no problem.
Feel
Thank
better,
you.
Mary.
Thank you. I have an
Everyone.
appointment on the 18th to get some of this removed. I don't know what I'm gonna have after this, but because I've got like a half cast.
Yeah.
So it's
Happy
very.
Thanksgiving, everyone.
Happy
you know,
Thanksgiving,
I
everyone.
can't cook, I
Everybody.
can't
Thank
eat,
you.
my left hand just doesn't do it, But I have plenty of neighbors and friends helping me out, so. Take care.
That's the
Take care,
best.
everybody.
Take care, Mary.
All right, happy Thanksgiving.
Bye-bye, everyone.
Bye-bye, everyone.
Bye-bye.